When an auditor reviews your DAP note, the rule is brutal. If it was not documented, it legally did not happen, and a weak note will not protect you or your reimbursement if a payer ever comes asking. DAP, Data Assessment Plan, is one of the most efficient progress note formats in behavioral health. Done right, it defends an audit and proves medical necessity. We will break down each section, walk through a real DAP note example, and cover the mistakes that flag audits. So, what is a DAP note actually for? Unlike private process notes, a progress note is part of the official medical record. Other providers, payers, and the client can request it. It must prove medical necessity and justify the level of care you billed, or the claim gets denied. And it lets any clinician pick up the case, what happened, how the client responded, and what comes next. Here is where weak documentation gets expensive. A note that does not match the billing code triggers a denial, and on retrospective review, a demand to pay the money back. Notes written in bulk or days late are a documented audit red flag. Best practice is finishing within 24 to 48 hours. This is where a generic EHR falls short. A generic system hands the clinician a blank box and hopes the right elements land in it. Behave Health is designed to support structured DAP templates, with required compliance fields enforced at the point of documentation. A DAP note has 3 sections. Let us walk through all 3. Data, Assessment, and Plan. Each does a specific job in the note. Section 1. Data. DAP merges what the client reports and what you observed into one combined data section. Their own words and symptoms, plus your observations, affect behavior and anything they brought in. Folding subjective and objective together is what makes DAP a streamlined, less redundant alternative to SOAP. Section 2. Assessment, your clinical take on the data. This is your interpretation of what the data means and where the client stands against their goals. Note whether symptoms are improving, holding, or worsening, and how the client is engaging with treatment. This is where you connect the session to treatment plan goals, the heart of demonstrating medical necessity. Section 3. Plan. What comes next? The concrete next steps, homework, the technique to continue, and any adjustment to the treatment plan. When you will meet again, plus any referrals or changes you are making before the next session. Here is what that looks like in practice. Client anxious about a job interview, 8 out of 10. Fidgeting and rapid speech when discussing work. Anxiety log shows 3 panic attacks this week. Work anxiety still high, but the client is more aware of their triggers and engaging well with exposure work. Continue graduated exposure. Client practices the presentation at home and uses 4-7-8 breathing before the interview. Auditors look for specific documentation problems. These are the ones that flag DAP notes. Cloned notes across sessions are a primary audit red flag. Every data section must reflect the actual encounter. Discussed feelings is not an intervention. Name the technique: CBT, motivational interviewing, exposure work. If a client mentions suicidal thoughts, abuse, or relapse, document it thoroughly with your assessment and response. A note with no connection to a treatment plan goal cannot demonstrate progress and cannot support continued authorization. This is where the right platform changes documentation. Behave Health is designed to support DAP templates at the point of care. Click New DAP Note, and the data, assessment, and plan fields are ready, with session type, clinician, and date pre-populated. Active diagnoses, treatment plan goals, and the medication list pull into the note, so you are not switching screens. The system flags timing mismatches, blank required fields, and notes that do not match the billing code before you submit. Risk screens and treatment goal links can be required before a note is signed, helping prevent the most common audit errors. Your DAP notes do not have to be the weak link at audit. Build them right at the point of care. See DAP templates built into your documentation workflow. Book a 20-minute demo at behavehealth.com.